I have the great pleasure to introduce our next two speakers who are about to have a conversation concerning health care. And I thought hard about how to introduce these two men. And the more I thought about it, the more I realized how much they have in common. They're both left-handed. They both love golf, a game that does not often reciprocate the love they put into it. They both are fanatic sports fans and go to great lengths to be in front of the TV or on the side of the court or the field. They both are master politicians. Each of them has only lost one election. They are both Democrats. They have fabulous daughters. They each married far above themselves. And they each love our country. And so please join me in welcoming number 42 and number 44, Bill Clinton and President Barack Obama.
Let me say that we still miss our former Secretary of State. And I should add that there's nothing she said that was not true, particularly the part about us marrying up.
Well, let's talk a little about the health care law, because we're about to begin on October the 1st, open enrollment for 6 months. And I'd like to give you a chance, first of all, to tell them why, when you took office, we were teetering on the brink of a depression. You had to avert it. You had to start the recovery again. Why, in the midst of all this grief, did you also take on this complex issue? Many people were saying, why don't he just focus on the economy and leave this alone?
Healthcare is the economy, a massive part of our economy. And so the idea that somehow we can separate out the two is a fallacy. Second of all, the effort for us to deal with a multifaceted healthcare crisis has been going on for decades. And the person who just introduced us, as well as you, early in your presidency, had as much to do with helping to shape the conversation as anybody. The fact is that we have been, up until recently, the only advanced industrialized nation on earth that permits large numbers of its people to languish without health insurance. Not only is there the cruelty of people who are unable to get health insurance, having to use the emergency room as their doctor or their health service, but we're also more efficient than anybody else. And so when we talk about, for example, our deficit, you know this better than anybody. The reason that we have not only current deficits, but also projected long-term deficits, the structural deficit that we have, is primarily based on the fact that we have a hugely inefficient, wildly expensive healthcare system that does not produce better outcomes. And if we spent the same amount of money on healthcare that Canada or France or Great Britain did, or Japan or any other industrialized country, with the same outcomes or better outcomes, that essentially would remove our structural deficit. So on October 1st, open enrollment begins. All these folks can start signing up for the marketplace. And what we want to make sure of is that everybody in every category, every age group, understands why health insurance is important, understands why they should sign up, understands the choices that are going to be available to them. They're going to be able to go to a computer, tap on the web page, and they're going to be able to shop just like you shop for an airline ticket or a flat screen TV, and see what's the best price for you, what's the plan that's best suited for you, and go ahead and sign up right there and then. And that open enrollment period will last from October 1st until the end of March.
The First Lady's trying to keep us all healthier, and you're trying to change the delivery and the pricing, and you have to cover everybody to do it. I think this is a big step forward for America. This will, over the next decade, not only make us healthier, but it will free up in the private sector largely funds that can then be reinvested in other areas of economic growth and give us a much more well-balanced economy. But first, we got to get everybody to sign up.
Everybody sign up. Go to healthcare.gov. Thank you very much.